Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this beautiful, crisp autumn morning, and not yet winter. I like that. Yeah. Joined today by some really great guests, Alan Greiner and Joe LeMaster, who respectively are the medical directors, and they have different titles than that, and they can tell us exactly, but that's basically what it is for both Wyandotte and Johnson County, and two of our outstanding faculty here at KU in the Department of Family Medicine, a department here that probably does, I think, as much as any of our departments, probably more in terms of service to our community, and delighted to have them with us here today. So thank you all for being here. And of course, Hawkeye.
Yeah.
How are you doing? It's a little better.
It's a little bit better. You know, again, just as we talked about, since it's been going on, there'll be fluctuations. We are fluctuating in the right way, though. Certainly today we have 67. That's better than in the 70s. Our total number.
You're shrinking.
I know.
You're shrinking.
I think this is what.
This is the effect of the pandemic.
This is what Logan and Anthony did to me.
No, this is what the pandemic.
They're getting back at me.
You're shrinking.
Sad cows.
Yes, sad cows.
So total 67 acute infections in the hospital. It's a lot better than in the 70s that we had yesterday. 20 in the ICU, 12 on the ventilator. We do still have 26 in that recovery period, but only 3 on the ventilator for that. In Hays, they still have a pretty large proportion of their hospital beds with 22 total patients in the hospital. 21 of those are active, and they do have 4 people on the ventilator as well.
So this is still a significant crisis for us, and it's crowding things, and it's crowding things like elective surgeries, or not elective, but those cases that are going to be admitted, because we've started deferring some of those patients and having to reschedule them to a later date so we could create enough beds for all the COVID patients. Well, let's first see if there were questions from reporters, and then I want to spend a few minutes, because we want to have a good conversation with Dr. LeMaster and Dr. Greiner.
Hi, good morning. Cody with Channel 9 again. It sounded like the hospital numbers are improving, which is good, but I know that there's still a strain on the hospital system. We're looking at the new numbers coming in from Kansas and Missouri, and the case counts, new tests are very, very high. Has there been any talk, and no one likes to use the word lockdown, but has there been any talk about moving into that phase, or is that something that's working behind the scenes? Going to peel back the curtain for us if you could.
You know, I'm going to, but I'm going to get to the part where we're talking with our two guests, because they'll be better about that. I can tell you, as a health system, we support measures of distancing and masking and things that are probably more stringent than what's out there right now, just because we see the same wave that everybody sees. If you look at the numbers in Kansas City, we are on an exponential curve. I think yesterday it was reported that the 7-day rolling average is over 1,000 for the first time in the entire pandemic, and up from 350 or 400 2 weeks ago and 600 a week ago, and now it's at 1,000. That's a really rapid rise, and if you take the rise in just the daily case counts and you see that and you start plotting it against El Paso and other places where they've had exponential growth, you would say Kansas City is experiencing exponential growth. And I was looking at the Washington Post today, and they report on the case numbers per 100,000 in different counties. And if you just look at Kansas, 2 of the top 10 counties in the country as far as the case counts are here in our state. So, you know, we really have some issues that we have to face. And the reality is there's only a few levers for us to pull. And those levers are all around our responsibility about how we conduct ourselves during the pandemic. So we're going to get to your question, Cody, but I want to involve the conversation with Alan and Joe. So let me first, if there's any other questions that don't involve these two guys, we're going to circle right back to you. Other questions?
Hi, guys.
Sorry, go ahead. No, go ahead, please.
Okay, thank you. This is Celia with the Kansas News Service. I wonder if you could talk a little more about what's going on with elective care. You're postponing some elective care? How does that work? And is it the same situation in your facilities in Kansas City, in Topeka, and in Hays?
Yeah, we have not done anything in Hays or Topeka to this date. What I will say is that what we've done is look at our list of surgeries and say, of those patients who are admitted, and this is strictly around the number of beds we have, of those patients who are going to be admitted, do we need to postpone some of those cases to a later date because we don't have enough bed capacity to take care of the COVID patients, or all the patients, really, it's not just COVID, to take care of all the patients? And the answer is that as of today, we started postponing cases. And what we did is to pick that list is we worked with our departmental chairs in each of the surgical departments. We asked them to pick 1 to 2 patients who they could try to defer that they didn't think would adversely affect that person's long-term health. Now, that's a judgment call, but we are deferring cases as of today because of the lack of beds, because of the overwhelming numbers of COVID patients. And I think, we're very fortunate. We're able to staff all of our beds, which many places aren't able to do. But we're also nervous about the increased number of our staff that are out with positive COVID from community acquisition. And the problem is there's uncontrolled spread in the community for COVID right now. And the rapid increase is going to affect everybody, and it's going to affect hospital bed capacity. So we are running short of capacity. We've had to cancel some surgeries today. We do believe that we can defer and reschedule those to a later date. We're trying to do them all within 2 weeks, but that will depend upon the COVID crisis itself. Next question.
Hey guys, it's Taylor, Channel 41. I'm curious about and I don't know if ratio is the right word, but when you see a spike in cases like this, is there a way to chart the number of cases that are asymptomatic versus those that are not? I mean, do you see a rise? Obviously, is it one of those situations where rising tide lifts all ships situation where everything means everything's going up, or do you see a difference in the number of cases that go up that are asymptomatic versus those that are not?
You bet. Well, I'm just going to get started with our experts. It's been time to bring them in because these guys know more about it than I do. Yeah. I know in the Finnish data that I saw, or the Icelandic data from Iceland, they said that about 40% of cases were asymptomatic based upon antibody testing that they had done in their general population. What are you all? And I'm going to ask Hawk too, but what do you think, Joe?
Well, I think that, thank you very much. Thanks for the question. I think that the point is that asymptomatic people are out moving around in the county and are transmitting the virus without knowing that they're doing that. We don't separately track on the total number of cases that are symptomatic versus asymptomatic. At least we have that information, but we aren't reporting that necessarily every day in the totals. But those that information is there, and we are the main issue is that people who are symptomatic stay indoors, and they're less likely to be out going around and transmitting. The asymptomatics are the ones that are transmitting more.
Yeah, the problem is they're asymptomatic, so we don't know. They may never even be tested. That's so, Hawk, what thoughts did you have about that?
My thought in listening to that question is, are we counting those as cases? Well, every positive test is counted as a case. The question is, why are people getting tested? And we do have little boxes that we can check here on our order sets for why we're testing. Are you a exposure to somebody of a known contact? Are you asymptomatic or symptomatic? I would expect, though, that right now a lot of the people are probably getting tested because they have symptoms. So it's really hard, I think, to track asymptomatic cases. There could be people out there just randomly getting checked. There could be people getting out there who are following CDC recommendations and as being a contact or an exposure of a known case are getting checked. But it's really hard to say unless you actually know why they're getting tested. But I would venture to say that a lot of the people that are getting tested right now are getting tested because they are symptomatic. But I don't have any data to go by for that.
But I think if you look at South Korean data and other countries, I do think it's about 40 to 50% of people are asymptomatic. And I think the younger you are, the more likely you are to be asymptomatic. Yeah. And so what I would suggest to us is if we're seeing 1,000 positive cases, those are just the ones who got tested. There's other people out there with symptoms and who aren't getting tested. And I bet it's a 1-to-1. Because I think that's what it feels like, and that's what Iceland said. That's what other countries are saying. So I think that's probably going to be about right.
And the scary part is I don't know that they're getting tested, so they're not getting counted actually.
No,
so we actually have lower or higher counts.
We're much higher than that.
See.
Yeah, absolutely. And I think that's a thing. So I want to circle back to Cody's questions now that we roped these guys in. So let's get back to that. So Alan, thoughts about stricter public health guidelines and where are we? And I'm going to come back to what the chief medical officers are trying to do. So your thoughts?
Yeah, I mean, I think most of us on the public health side feel like that this making some changes now with the rising case counts, with the burden we're seeing in hospitals. I think we feel like if we can do some things to make some changes now, I don't think we're talking about full-on lockdowns. We've seen some other countries do that, of course, in recent weeks and months. But I think we're looking at and having conversations across the Kansas City metro area about what changes could we make in terms of gathering sizes, in terms of restricting that grouping of people that we think now is really causing a lot of spread. Because with the rates the way they are, as you said, everybody needs to assume everybody else has COVID, that they're around. And so we've got to start, thinking about what we can do to prevent those interactions.
So, Joe, I know in Johnson County, this is a hard conversation because there are a lot of people who don't want to have to do it. There's some people who believe we should try and just get herd immunity and all that. What's the mood there?
Well, the mood is always a little bit difficult to be able to gauge because we have, a very diverse county and a lot of people with a lot of different opinions, some of whom come forward to some of our meetings to express them in various ways. But generally, I think it's been very supportive of the things that we've done in terms of public health measures thus far, and we continue to enjoy the support of our county commission in moving forward in all of this. We're collaborating very closely with them in everything that we design. Obviously, any new actions that we take, given the recent changes in the legal system, have to be agreed by the county boards of commissioners, and we are working closely with them to have that happen. We think that as we move forward, that we'll see good cooperation on the part of the people in all of our counties of the metro, because everybody realizes now that the situation has got really bad. We're having conversations with leaders of our school districts. We're having conversations with the CMOs that you mentioned about, the chief medical officers, and we're really getting to a situation where staffing of these institutions is becoming really critical. And if we are not able to do something to reduce community spread quickly, we're going to see all those institutions overwhelmed the way that a number of other large cities in the U.S. have seen it. And we don't want to go there. It may not be entirely possible to prevent it because the numbers have shot up so quickly and so greatly in the last week. We're in a phase, at least in Johnson County, of exponential growth in the number of cases right now. So this is a very dangerous time and very important to be able to take action that's going to make a difference.
Yeah, and you guys have said it great, and I would just say to Cody and to all of our listeners and anybody else who can help us with this, we're at a crossroads, folks, and we have a choice to make, and our choice will dictate how the next months or year goes for the health of the people you care about. And when you get overwhelmed with healthcare resources, it's not just the COVID patients who suffer, right? It's if you have a heart attack or a stroke, where are you going to go? So I'm with the hospital. Well, not if the hospital's overwhelmed. Where are you going to go? That's the choice you face. And I think if you're in a car accident and you have big trauma and you need to go to the hospital, where are you going to go? Well, if the hospital's overwhelmed with COVID-positive patients, where are you going to go? I mean, that's the choice you face. It's not just the COVID patients. It's all of our patients. It's all the people we have to care for. We saw Dr. Jamie Wagner is a breast cancer surgeon this week. She talked about what's happening in breast cancer. She sees far more advanced breast cancer because people couldn't get in and get the mammograms for months when everything was shut down. Well, that's a terrible answer. So when people say, I can do anything I want, I'm like, no, you can't. That's ridiculous. Mm-hmm. The Constitution starts with we the people. It doesn't start with I the one. It starts with we the people. We're going to talk more about that in just a minute. Let's see if there's other questions out there.
I do have one from KCTV5 while other reporters on the line consider more questions. KCTV5 said that there is a report about a breast spray that would help fight COVID.
Well,
and
there is one.
Yeah.
There
the
is
breast
one.
spray that you could spray.
Yeah, it was used in ferrets. We actually referenced that the other day. It's in ferrets in a study. And what happens is you take the spray in your nose. I think you'd have to do it at least once or twice a day, and it helps protect you from getting COVID. But it's in ferrets. It's not in people yet. I'm sure it'll get. Intense interest.
I think there is one that they're talking about.
I think there's a lot of different products out there. So I think that the nice thing about coronavirus, SARS-CoV-2, is that it is very susceptible to a lot of household cleaners. So very simple things. It is very susceptible to other products that are also safe for use. Obviously, we know bleach and other things, household cleaners, aren't safe for use in our bodies. But there are a lot of compounds that can inactivate SARS-CoV-2 that are also safe to use in our bodies. I think the big thing to understand is, a lot of these products that are out there, even Listerine has shown to be effective in inactivating SARS-CoV-2. But what is the reality of the totality of protection or treatment? Certainly once you get infected and you're using those products, your body is replicating that virus enough where, yeah, you can probably kill what's in your upper respiratory tract or in your oropharyngeal, your mouth area, but you still have other replication of that virus in different parts of the body. We know that it can replicate in your lungs. We know it can replicate in your GI system. So all of these products, they may look in the lab to really inactivate or kill infectious virus, but we don't really know the utility of protection and even treatment of SARS-CoV-2 or COVID-19 with these products. So I think it's really important that when these products come out, yes, you can inactivate it in the laboratory setting, but what is the actual day-to-day use for that, and will it cause protection or treatment of these? I think those types of things need to be done in studies where you look at either people who could be infected, just like the vaccine trials, and doing that and see if it does protect against infection, and then once people have the infection, look to see if it's treatment. So
Yeah,
again,
and let's be clear, we're not recommending any of those things.
Correct.
Because you'd have to inhale them on a continuous basis for them to work because they have a short-term effect.
Yeah,
My
I
point
think
about
that's the
ferrets
important
is
part.
actually important because the ferrets are actually a good animal model for
Yeah.
coronavirus infection because the way they get infected is very similar to humans. And so ferrets are being used as a way to try and establish whether or not new therapies can protect us. And there are some novel ideas. It was released earlier this week and published that about using a nasal spray that's been developed to try and essentially form a protective barrier that lasts for a day in your nose. And what happens is if coronavirus comes in, it wraps itself around the spike protein and prevents it from being letting into damage to your airway and then prying itself into your airway epithelial cells, which is a way of saying it prevents it from getting into your body. So there may be an answer in ferrets. We'll have to wait and see, but it
Yeah.
actually is a very good model for transmission of it to humans. If it can work there, it may work in
Yeah,
humans.
I'm skeptical just because we know we've seen so many other things. But certainly, if we can do the trials and get accurate data about protection or treatment, I'm all for that. But I'm skeptical, just as with hydroxychloroquine, with vitamin D, none of these things have been shown to really be effective at prevention or treatment of SARS-CoV-2. We do have good data on things that do work, but none of those have yet been able to be validated on the other products as well. So I think,
And they may well do damage to you. So unlike the
Yeah.
the study that's in ferrets, which is valid science, well-funded, NIH sponsored, I mean, that's the real way to go. Don't go spraying Listerine in your nose. You may end up
Correct.
causing more damage to yourself, and certainly Clorox would be the same.
There is a follow-up question to that, and I think that they were aware of the ferret thing because you had mentioned it. I think they were leaning more toward the mouthwash and mouth sprays.
yeah, got
But
it.
one of the questions that the follow-up is, if you do spray it and it does help here,
Yeah.
does that then, even though it might be in my body and I may be asymptomatic, does that prevent it from spreading out?
possibly, but again, without really knowing exactly the product, your body is replicating that virus at high titers, millions of copies of virus. So just as Dr. Steit said, it needs to be a continual thing if there's probably any benefit. So it's really hard to tell without knowing the product and what data is out there. I think it's really difficult, especially against protection, especially if you're just using in your mouth, because we know you have your eyes and your nose as well where you can inhale it. It can replicate in the cells near your olfactory bulbs, and that's why people lose a lot of their sense of smell as well. We know it can replicate down in your lungs. Those products probably don't get down into your lungs, and so there are still other areas that those viruses can replicate.
All right, next question.
I have another question. This is Celia at Kansas
Hi,
News
Celia.
Service again. I wonder about the effect for rural Kansas of the cities filling up. I talked to a small hospital in central Kansas yesterday. They don't have an ICU, so they send their COVID patients elsewhere. In the past week, they have not been able to find space in Kansas. They called 8 different hospitals. They ended up having to send their patients by ground ambulance to Omaha, Nebraska and Lincoln, Nebraska. And I wonder, can you fill me in on, is it a day-by-day thing? Maybe some days you have to turn down transfers from smaller hospitals in Kansas because you're too full? Like, what are you guys seeing?
That's exactly right. Now, we're seeing exactly what you just said, and that's the real story. And that's the problem. And what's different between this and New York, for example, when early in the crisis, is that was one city or 2 or 3 cities that spiked, and the rest of the country could help them. In this case, the entire Midwest is on fire. And as a result, we're struggling to get patients placed. And so people, when I say we, I'm talking about the entire Midwest and certainly the state of Kansas. And these rural hospitals, like the one you just mentioned, are often spending 5 or 6 hours trying to get a patient placed. And the struggle with that means is that critical care is a time-sensitive diagnosis. So if you have to go on a ventilator, how you manage that ventilator makes a huge difference, especially in those first 24 hours. If you don't do it right, you could actually cause much worse damage to somebody. And so as a result, you need to get it to people who are trained in this and are ready to handle COVID or any other critical illness. Because again, it's not just COVID patients that can't get transferred. It's a heart attack, it's a stroke, it's everything else that can't get transferred. So this it affects everyone. It doesn't just affect the COVID positive patients. It affects all of us. And so you can't get a patient transferred. It's really a struggle. And so, that is a real dilemma. It's a real problem. We're seeing it every day. And you guys work with some of the rural programs too, I think. Your department does. What are you hearing from some of your colleagues?
Well, Alan has that.
All right, I'll turn to Dr. Greiner.
Connection too. Yeah, I think that there's our connections with them suggest pretty much what you were saying, that people are having an increasingly difficult time being able to figure out where to send people. Alan, I'll pass that back over to you.
We've got a group of county health officers that meets every Thursday night, and last Thursday we heard similar stories. One hospital in Southeast Kansas talked about having to call 11 facilities before a transfer went through, which does take hours, because sometimes you wait half an hour to get that call back. We talked to one of the physicians out in Garden City, out in Southwest Kansas. Same kinds of issues happening all the way out there. They're looking to send people to Colorado, but Colorado's full. So there's really no great system either for handling this, which is kind of scary as well, right? We've got this pandemic, and we've got these staffing issues in all these hospitals, and really we don't have a streamlined system to figure out where might there be an available bed, and it does vary day to day. So it's really tough for these rural providers right now, and they're facing different cultural issues in some of their communities too. Dr. Lemaster mentioned county commissioners. There's a lot of people out there who really don't think still that this thing applies to them, and that they need to have mask mandates in place, or they need to be changing the way things are happening with their schools or with other social events or gathering things that are happening.
So go ahead.
Yeah, no, I think exactly to all of your points too. It's not just COVID, and you said this when you first were answering the question. It is things for heart attack, stroke, other life-threatening infections that aren't COVID that people can't get transferred, and it is a significant problem. We had the ICU directors call yesterday, and we have other ICU providers from around the state, and that's exactly what what they were saying.
So, and further answer your question, as far as taking patients, it is a moment-to-moment and day-to-day thing. We've had to turn down many more. Like in the beginning of the crisis, we had to turn down in
40.
the month of
May.
April or May 40, but in October we turned down 140 transfers. And so the struggle for us is real, and the struggle for patients is real. And the only way to solve that is to follow the rules of infection control. There is no other bend to the curve. When the vaccine comes out, monoclonal antibodies come out in 2 or 3 more months, that's a whole different story. But in the meantime, the only way to bend the curve is to follow the rule of infection control. So I'm going to go to my soapbox for a minute. That's a slippery place, but let's just read it. It's the preamble to the Constitution of the United States for all those people who want to know what I'm about to do. We the people, it says, remember, it's bolded, right? It's bolded. We the people. It doesn't say either one. Of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty on ourselves and our posterity. How are we going to do that? To promote the general welfare and establish justice. How are you going to do that? It's not hard. You wear a mask. And for people who say that I don't have to wear a mask, I suspect are the same ones who say they should be able to smoke inside a public space and make everybody else sick. It's like I can drive my car into a building. I can light a building on fire. No, you can't. Secure the blessings of liberty on ourselves and our posterity. That's the freedom. But the freedom part comes with responsibility first. And it says we do that. And we do it together. And how do we do that? We do it by making sure you wear a mask, you keep your distance, you wash your hands, you cough into your elbow, you don't go out if you're sick. We the people. That's what makes the difference, not either one. Next question.
How far away are you getting transfers requests?
Yeah, we've gotten them from Arkansas, Colorado, Oklahoma, Nebraska, Iowa, so a big region. Missouri, obviously, so a big region. We're getting people requesting because they don't have beds and they can't place patients either.
So you ready for community questions?
Let's go.
Want to rock? All right. If you don't track, Lindsay wants to know, if you don't track symptomatic versus asymptomatic, and I think you said you do.
I'll come back to that. Yeah.
Okay. All right.
No, I can respond to that.
Go ahead,
if you want.
Yeah, go ahead
Finish
right now.
I didn't quite hear the end of the question, so I want to make sure.
Oh, okay. The question is, how does this impact the positivity rate if you're not tracking that?
Oh, yeah. So how many patients do we really have?
So what the situation is, I just want to clarify that because I think my former answer might not have been that clear. So in order to be able to, we get in responses, we get in positive tests, total tests from all the labs that are collecting those, as well as from the state itself, from our county methods of collecting that. And then we do something called case investigation. In order to be able to say when the symptom onset date of each positive test was, you have to contact those cases and be able to find out, first, were they symptomatic, and second, when did their symptoms start? And we've been tracking that right from the very beginning. But here's the kick. Because the numbers of cases are rising so quickly, we can't keep up with the case investigation to be able to contact even the cases to be able to say when their symptom onset was. So we're behind in our case investigation because the numbers are overwhelmingly high now. So we had a pretty good feel about this when the numbers were lower. We were able to keep up with the cases as they came in. In all of our jurisdictions, we're behind. So that's the issue, is that we are trying as hard as we can to get the symptom onset date to be able to, help those folks and to be able to keep track of it, but it's just too many.
Loretta, how do you know then where exposures are actually happening currently at the higher rate? Is it grocery stores, restaurants, offices, workplace, schools, or is it truly large gatherings? Or going to appointments and shopping?
Yeah, Alan, I know you guys have done some work. I know you and some of the CMOs, we've been talking a little bit about that. Talk to us about those spaces where you guys know that the greatest transmission occurs.
So, in answer to that question, I think we know transmission is happening in all of those places, right? Some are higher risk than others. But again, I just want to reinforce we have to assume when we're anywhere that everyone we're around has COVID right now, and so you got to protect yourself by not doing things and distancing and masking. But we're seeing certain clusters, right? Of course, long-term care facilities are really high risk. We see lots of clusters in that kind of setting. Workplaces, certain workplaces where people aren't able to physically distance as well, continue to be a problem. So manufacturing or transportation industry environments. We've still got a cluster of cases in our sheriff's department in Wyandotte County, which is just because they have close contact doing the work they do. We've seen it in incarcerated populations as well. But in different social settings, we continue across the state of Kansas to see faith-based settings have clusters. So if people are congregating in faith settings, that can be an issue still too. So anywhere people are together, it can happen. And again, I think we just have to all assume that others have it and curtail our activities as much as we can in the coming weeks.
So I think I saw something from the Metropolitan Area Regional Council 2 days ago. We were talking about this, and what I heard was indoor sporting events have become a real problem. I'm not going to get all of these right, but so not schools per se, but the after-school events are the issue.
Yes, I think that what we're seeing, at least in Johnson County, we're seeing more cases arising out of parties that are either after sports parties, in particular weddings. We've had a number of cases arising out of weddings. Any kind of, in particular, indoor events that happen. And when there's food shared, if there's alcohol in the picture. The other situation that we have a lot of concern about is bars and restaurants. People are taking off masks and spending extended periods of time, probably closer than they need to be, in bars and restaurants. We don't have any current active restrictions, in that regard. So that's a really dangerous time to be when we've got this much going on.
So the word uncontrolled means uncontrolled, widespread community transmission. It's everywhere you want to be, right? It is. It's everywhere you want to be. And I think I saw something that said in a group, when you said in a size, a gathering of how many people was 40% of the people, 40% chance. Do you remember that?
Yep. There's certainly a website and a tracker that you can assess your risk based on number of people in a county.
And because it differs from one county to another.
Right. You can look at Wyandotte, you can look at Johnson based on the number of people at that gathering.
You can look at a county in Montana. It's right. It's a pretty cool tracker. So what did it say? So
for this last week for Johnson County, I believe if you have 15 people there is a 30% chance that one person will have coronavirus. If you have 25 or 50 people there is an almost 60% chance. Maybe a little bit off on those numbers, but the more people you get at a gathering, the higher percent or the higher chance that even just one person will have the disease.
We were trying to call it up, and so be patient. It says they have too many users trying to use it right now.
Okay.
We can't even get it here, which is a good thing.
But that's a good thing.
Basically, it's a COVID-19 assessment tool or something of that nature. You could probably Google that, and
we'll see if we can bring it up.
You could do it all anywhere in the nation, any county in the nation. So
okay.
All right. So clarification from Ann. Are you stopping contact tracing in Johnson County then if you're overwhelmed?
Oh, no.
Because she says she knows a lot of people that have caught it at work and they haven't received a call.
Right. So we're doing all we can. We are working as quickly as we can with the staff that we have available. We're trying to bring in new technology to try and support us with that. So we're trying to build it up. We're not stopping contact tracing. Remember, though, that contact tracing in the state of Kansas with new legal changes we've had in the last year is a more fraught thing. People have to be willing to give us the names of their contacts, and that's an issue, that we have to work with every time that we're talking to somebody who's a new case. So it's a difficult thing to be able to do anyway, and it takes a lot of time. So we're doing what we can. I think that the current situation is that we're trying to talk to all of our cases and telling them to reach out to their contacts and provide information to us about it. But it's a difficult thing to be able to keep up with.
Okay, Shannon O'Brien is having trouble getting through. Can the crew hear me?
Hello, can you hear me?
Yeah, we hear you now. Go ahead, Shannon.
Oh, yeah, great, awesome. Okay, thank you. Hi, guys, this is Shannon O'Brien with Fox 4 News. I've got two questions. First of all, for the doctors, I know you're not public, you don't make public policy. You're all about the medicine side of it. But in your opinion, and in your mind, where is the tipping point where we should shut this economy down again?
So I'm going to first turn to our public health officials because they're better versed at answering that, and then I'm going to give you my CMO response. Okay, Alan, let's start with you.
Well, I think that we've learned a lot in the course of this pandemic in terms of what we can do to slow spread. I really don't think right now on the public health side, and I'm interested to hear Dr. Lemaster's version of this too, I don't think people are really looking at shutting down the economy. I think we've learned enough about what it takes to limit spread that I think we can do other things to slow spread and get this under control. If you remember back in the spring, we didn't really even understand what masks could do to limit spread when we went to stay at home, shelter in place, shut the economy down mode. So we know a lot more now about that. And I think we know that in a high risk workplace like a meat packing plant, for example, if everybody's rigorously wearing their masks and being extremely careful, we're not going to have that much spread in that environment. So I don't think we're talking about it shutting down the economy. I think we're talking about doing things like Hawkeye was just talking about, limiting the number of people, and wearing your mask makes a huge difference. And so if there's ways we can structure those orders, we want to do that in coming days because we really do have a crisis going on right now.
Joe?
Well, one thing I was going to ask the person who asked the question is, what do they mean by shutting down the economy? If the interpretation of shutting down the economy is anything more than we're doing now, right now, I would say we're at that tipping point. The next thing that happens after where we are now is the hospitals are overwhelmed, and there's people who need to go into the ICUs in our hospital who are dying of COVID in the emergency room, and we have no place to deal with
stroke. I mean, it's not just COVID.
That's right, exactly.
It's not just COVID, it's
everybody. As you said before, it's everybody. So there is no place else to go at this point except into a situation of burning down emergency. So I think we're already at the tipping point where we need to take additional action. If by you mean shutting down the economy, that means going back into a stay-at-home order, I don't think that that's what we're contemplating.
And I have an answer for you, Shannon, but it's in the form of a riddle. Shannon, what's the most dangerous spot and the safest spot at exactly the same moment?
For COVID.
Wherever you are.
That's a really good answer, actually, but it's the hospitals. Because hospitals have COVID wards where we cohort all of our COVID patients together. So if you go onto our COVID floor, there's 25 or 30, whatever the number of beds on that floor is, and every one of those patients has COVID. And our staff, now, we're still open for business, right? So what's the rate of transmission from our COVID positive patients to our staff who are taking care of those patients? And the answer to that is 0. So if you do infection control correctly, you don't have to shut down the COVID ward. Actually, we're open for business. And you can keep everybody safe. And how do you do it? You do it by following the rules of infection control. And that's, I think, what Alan said is so right. As chief medical officers, we're working with county health officials, and we're working with these two great folks here and elected leaders. And I think in the coming days, you'll see something come out from us about it. But we're not saying go shut everything down. We're saying wise up, right? Wise up. You got to wear a mask. You got to keep your distance. If you don't have to go outside, don't. And if you're sick, cough into your elbow and it's all the rules of infection control. But the two big things are wearing a mask and keeping your distance. So we're not saying go shut everything down. We think that's really bad for mental health. That's really bad for people who need to have a job. I mean, that's not the right answer. The right answer is to follow the rules of infection control. And the proof is that the most dangerous potential spot in any community in the United States or in the world is also the safest spot. Go figure that out. Because you see, that's the proof. And it does amaze me that people want to have all these battles and they're ignoring the proof that's right in front of all of us. It's right there. That's what you have to see. Mm-hmm. You got anything else?
No, I think you're exactly right. There are certain populations with their opinions on what they think about the virus and what it is and how to protect or not protect. But those opinions really aren't based on fact because there is plenty of published, good, peer-reviewed science to go against that and really endorse the public health guidance and the public health measures that we've been talking about.
Go ahead, Shannon. You had a follow-up, I think.
Yes, thank you. And I did mean a second shutdown. I probably just said that wrong. So I know that there's been a lot of conversations, specifically in the last few days, between public health officials trying to get on the same page about what's the next step to try and bend the curve. So can we get some some details about what those conversations were and what has come out of it from the public health officials, please?
Okay, we'll talk. Which one of you wants to take that one first? Oh, Joe just passed it over to Alan. Well, Joe just handed it off to Alan. That's a good hand. You look like Mahomes on that little lateral pass.
No, I was on a call before this call with some of the other public health officials in the metro. I don't know. I don't think, Joe, your colleague, Dr. Ariola, was on that call, but I know that Rex Archer in Kansas City, Missouri, who's the public health officer over there, is looking at a list of recommendations to put out, and we'd like to be part of that if that happens. So we're sort of negotiating. All right, because we've all got different sort of size limits on gatherings right now. Can we reduce the size gathering sort of recommendation down to a smaller number? So you will probably see that in the coming days. All of us sort of saying, let's keep our groupings of people at 25 or even 10 people or smaller. Do we need to as earlier, things like that are probably going to be in there too. And then, what do we need to do in terms of enforcement? I think we're all thinking about that as well. Are there some things we can do to get more of our, city, county governments involved in just following up and doing more education? And we haven't figured that one out yet. I think that's the toughest one. But I think you're going to see some new recommendations, possibly some new orders and ordinances from some of the counties in the coming days. Probably not all of them, because it is hard to get everybody on the same page, but certainly from a chunk of us in the metro.
Hey, I'm going to turn to Dr. LeMaster. I was whispering to him in a minute. Hey, let's talk about what's going on in Wichita. And you said, I was just going to do that.
Yeah, so in Wichita, I don't know if you're aware, just 3 days ago, the local health officer there, Dr. Mins, who's one of our colleagues, brought
Dean of the School of Medicine
in Wichita, but also the local health officer in Wichita, brought to them an order which we're looking at really closely, which was doing a number of different things, limiting the size of mass gatherings we talked about. There are a number of different elements of that went into that. We want to continue. They had some things that they were doing that we don't need to do, because in Johnson County we have affirmed the mask mandate, the governor's executive order 2052, and are continuing to follow that. So they sort of built that back in because they had not had that in there before. But we're looking at that very closely. The county then took some additional actions to try and promote enforcement of that. So that's a model that I think we're looking at as well. They're in a situation very similar to ours, and we are all considering what they did as well as we move forward. I think that the issue is that all of these large jurisdictions need to think very carefully about what next steps are. It's all under discussion at this point. So, talking about details would be probably premature, because we don't really we haven't had those kind of conversations where we are even able to say anything intelligent about it until we've had more conversation about it. But we're all talking about it. You're right about that.
You're talking a lot, too,
We're talking
frequently.
a lot. We're talking frequently. The conversations are there. Some of those conversations you'll see more about, coming out very shortly, I think. But I don't want to. I would not want to say anything more about it because we haven't yet. We're just talking about it now.
And the chief medical officers and public health officials have a call on Friday as well to try and kind of make sure we're all trying to stay aligned. From the CMO group, we just say, gosh, in this situation, we're in a crisis. Hospitals are overwhelmed. We don't have, we're getting too darn busy, and the potential for being really overwhelmed is there as we watch the exponential rise of the curve. And today we are, we're right at the edge, and at any one moment you may tip over the edge. But when you start can't take transfers and you have to delay care, then you're in trouble. And I think that's where the city is. And because most hospitals are all of the high ICUs I know in Kansas City have struggled to take patients over the last couple of weeks. And so I think when you get to that level, then you have to start saying, gosh, we really got to think hard about this crisis in our community.
I think we have we have so many questions, but there's two I'd really like for you guys to get to. One is Evelina, and these are follow-up questions. She wants to know, how are you so sure that the hospital staff isn't getting sick from COVID patients? How do you know that, especially with the incubation period?
Yeah, so we actually do really good contact tracing in the hospital, and Hawk, you can talk about this, and it's inevitable that when we go examine it, we can find the place where they got sick in the community, but they're not getting sick on the ward. No,
this has been going on since day one. We've had a lot of resources going toward contact tracing of our employees. Also, a lot of resources going towards looking at all our COVID positive patients, and certainly because they are cohorted in similar wards on the same ward together, for the most part, whenever there is an employee that is positive, there is people who do those contact tracing and those investigations. And when you talk and interview the people that are positive, they may have gone on a bus trip with other friends of theirs to a winery. They may have had a party or a wedding, just as you said. So we can identify other places where multiple people in those things were positive. So there is a lot of resources for our employees going towards contact tracing.
And I think you should clarify, too, these employees that are getting sick are not all working on the COVID floor. They're working in other places. They don't even come in contact with these patients, right?
The employees we've heard about us talk about the last few days are all employees. The ones in the COVID wards actually tend to be some of the safest because they've got such outstanding techniques in infection control. And so we do well there.
And then David has a follow-up question. He wants to know, with all the high percentage of people suspected of being positive in group gatherings, does that mean we're reaching herd immunity?
No, we're not even close, unfortunately.
No.
What percentage of people do you think y'all are sick at any one point in the community? And as you answer that question, well, let's go ahead and wrap up too. So, Alan?
Yeah, at any given cross-section in time, right, it's a relatively small number, but that's how you get to those calculations that Hawkeye was talking about earlier, right, where if it's 15 people, there might be a 20% chance that one of them has it, but I would say it's in our counties, maybe a cross-section right now with the exponential growth, we might be up to 2 or 3% of everybody has it right now and is potentially infectious. But to get to herd immunity, right, you hear people saying, well, we need to have 70 or 80% of the population and have had it and have antibodies. We're nowhere near that, right? We might in Wyandotte, our rates have been a little higher, right, since the beginning. We might have 10, 12% of the population have had COVID in the last 8 months. But that's way, way lower than 70 or 80%. And it's too, we cannot wait for herd immunity, right? We have to change our behavior now, and hopefully we have to have new therapeutics and a vaccine soon.
Just to say, if we try to all get out and herd immunity, we won't have any beds for those COVID patients, and we clearly won't have any beds for the heart attacks, strokes, and everything else. So the death count will be untold.
Yeah, I totally agree. There's a couple of things to sort of add to those comments. First is that those surveys that have been done, there have been some in some of the large communities, some surveys of the proportion of people that were positive, sort of asymptomatic surveys that are done in the population, as well as the antibody surveys. The estimates were somewhere between 5 and 10%. One of the problems that we've got with using antibodies to do those surveys, as we talked about earlier in the spring, is that the antibodies wane after the person's been exposed for a period of time and are no longer, readily detectable. So it becomes more of a problem to be able to get that estimate. Yeah. But one thing I wanted to address before we finished, and that is the whole concept of COVID parties, because we've become aware, that there are a number of people who are promoting this idea of herd immunity, who are getting together with positive people deliberately to try and get COVID so that they can push the herd immunity. And some of those are in families with kids in school, and sending kids to school who have been intentionally exposed is a really, I think, a really dangerous idea. And all of this, makes the assumption that most people won't be symptomatic and most people will be okay if they get COVID. But you have no idea about that. Do you know that about half of the hospitalizations thus far have happened in under 70-year-old people? So, we're not talking about something that's only affecting the older adults. This is irresponsible behavior and it needs to stop.
Thank you. 100%.
We do have people too that want to know if they can volunteer and help in any way with the counties, with contact tracing or anything like that, where the Facebook is blowing up. Right. Kansas Cityans always want to help.
They always want to help, yeah. I think that the main thing is contact the public health departments. We've got a call-in, we've got public-facing call lines where people, if they're interested in doing that. Remember that in order to be able to do contact tracing, most of that sort of work is done on the phone. We have had volunteers. We've had medical students that are volunteers. We've got nursing students that are volunteers. People that have had some sort of medical training would be helpful to have step forward, but remember that, it does take time for our staff that are already overwhelmed to be able, trying to do the contact tracing, to train large cadres of new people and get them plugged in. So I would say call if you're interested in doing that, but also be aware that we're already stretched to the max. So, Alan, did you have anything to add to that?
No, I think both counties have a 311 line you can call that can take that. I know we've also got a box on our website, ycokck.org, where folks can volunteer for all sorts of efforts related to COVID. We've also got food drive activities going on in the county, and I think there's other organizations that do too. So yeah, reach out, and we've got mechanisms to try to plug folks into things.
Yeah, herd immunity in the case of COVID-19 or SARS-CoV-2 infection is an extremely bad idea. Herd immunity is usually obtained either by vaccination or infection. We understand that the best example of herd immunity probably is chickenpox, and this is because it was built upon generation of children getting it. We know chickenpox in the pediatric population, it tends to be more mild, certainly more mild than an adult. So getting to herd immunity is going to be extremely dangerous. There is no science or validated information or data that would support getting to herd immunity for SARS-CoV-2 infection. This is because we know that even with common cough and cold coronaviruses, you can be reinfected within the same year. 9, 12, 15 months after the original infection. And we have seen in very good published reports that you can be reinfected with SARS-CoV-2. Some cases as little as just over 60 days after your initial infection, but even out to 120, 140 days. The problem is with this, we don't understand exactly what's going to happen when you get reinfected. We hope that you have less symptoms and less severe symptoms, and certainly some of those published reports would say that. But the other published reports say that those people are actually more symptomatic and had worse disease. So again, the prospect of getting to herd immunity through natural infection and going out and actively trying to get that for you or your family members is an extremely bad idea.
I want to say thanks to our listeners. We've gone long today, but it's been an incredibly important message, I think, today. And I'll just say, Alan and Joe, you're coming back soon, because we got to keep on this message about the public health, and you guys are terrific to be here, so thank you. Tomorrow we get to answer your questions. Amanda Gartner will be back along with Dr. Hawkeye. Also, Linda sent us this picture of her favorite Star Trek mask. Beam me up. To symbolize this, live long and prosper. Love that. Send us your photos. Hey, you know what? Got 5 rules. Had 5 rules in the ICU. I used to teach it to my staff. I did it as a chair. 5 rules. Rule number 1, we the people. We're in it together. It's not either one. Rule number 2, do the right thing. Wear your mask, keep the distance. Rule number 3, be the bridge to the better day, and it's not that far away. If you look at it now, we got like 20% of the time that we've already been in this to get to things like vaccination and monoclonal therapy. You can do this. Ask questions, seek answers. Always ask us questions. We're going to be here. We'll try and ask your, please ask those questions. We'll try to answer them in a calm and honest and straightforward way. And that's what we need to do. And it's fair to ask questions about vaccinations and masks, but then you have to believe the answers from science. And then rule number 5, those who laugh last. It's important for you to continue to take care of yourself for your mental well-being and your emotional health in this really difficult time. Those 5 rules. But it starts with we the people. We're back tomorrow. Remember, in the meantime, there's still no place like home.
If you're reading stories or watching videos about this before bed, you're going to get yourself worked up and you're going to impact your sleep, which is something that's so essential in trying to keep your wellness at the optimal level. These are hot button issues for people when we talk about health and we talk about equal justice and equality. These are getting at those real core emotions that we have as humans. Go for a run, go for a walk, bike ride, hit the gym, whatever it may be, to discharge some of those tense feelings so you're not screaming at the TV or just randomly in traffic screaming and pounding the roof of your car. So if we can all just try to be the best version of ourselves and support one another through this, I think that's really the road that we need to try to take. Remember who these people actually are to you. Think about the things they've done for you. Think about how much they've meant to you. So if we can all just try to be the best version of ourselves and support one another through this, I think that's really the road that we need to try to take.